Good morning, everyone, and thank you for being here on this incredibly cold winter day. I would have to say that the first official day of winter certainly did not disappoint. My name is RJ Sigurdson. I'm the MLA for Highwood, and I'm proudly here today in my role as Parliamentary Secretary of EMS Reform. I'm here today with our Premier Danielle Smith, Minister of Health Jason Copping, Alberta Health Services Official Administrator Dr. Cowell, representatives from Alberta Health Services, and our University of Calgary hosts, which I would like to thank them for hosting today. We have all come here to share some significant updates in the work that is being done to improve our province's healthcare system. Everyone here has made this work a priority, and progress is being made. I will have more to say about this later, but I would now like to invite Premier Smith to kick off today's announcement.
Great, thanks MLA Sigurdson, Minister Copping, and Dr. John Cowell. Good afternoon, everybody, and thanks for joining us here today. Since day one, I have been clear that the government would implement a healthcare action plan to build a better healthcare system that Albertans expect and deserve. A system that better supports better care for Albertans when and where you need it the most, while setting clear measurements for success. Last month, Minister Copping, Dr. Cowell, and I announced a number of priorities to accelerate the changes Albertans need. These priorities are improving emergency medical services response times, decreasing emergency wait room times, reducing wait times for surgeries, and empowering frontline workers to deliver health care. It's been just over a month since we launched the plan, so I'm pleased to be here to give Albertans an update on the progress that's being made, especially on EMS wait times. We all know Albertans are waiting too long for an ambulance to arrive to help in what may be someone's greatest time of need. Starting today, Alberta Health Services will use alternate modes of transportation for non-emergency transfers of patients instead of using ambulances where it's clinically appropriate to do so. This will free up ambulances and paramedics to respond to more emergency calls and to provide urgent care faster. It's important that these highly trained professionals can deal with actual emergencies and not shuttle patients from one place to another. This program has already been successfully piloted in a number of municipalities: Calgary, Bonnyville, Valleyview, Athabasca, and St. Paul for 6 months. The result of the pilots have already been clear. The program diverts 15% of ambulance transports, which will allow for an additional 70 responses a day province-wide. That means 70 more possible ambulance trips for actual emergencies every day. It allows our world-class paramedics to do what they were trained to do. And even more importantly, lives will be saved because we have more ambulances available to respond to emergency calls from Albertans, bringing paramedics to administer their excellent and life-saving work. I'm confident that this change will mean reduced wait times for EMS services, making our healthcare system stronger and better. And our work doesn't stop there. Dr. Cowell and the team at AHS are doing a number of other things, expanding hours for non-urgent pediatric clinics, increasing supports in emergency departments to support the assessment and discharge of elderly and frail patients, and working with community partners to facilitate safe discharge for individuals experiencing homelessness. This is our healthcare action plan at work, and we will have many more announcements like this one to talk about in the coming months. I'd now like to invite Minister Copping to provide more details about the program.
Thank you so much, Premier. It's great to be here and welcome you all to the heart of Calgary Varsity, Foothills Campus and University of Calgary. I want to start by offering my heartfelt thanks to all our healthcare workers who continue to put the needs of Albertans first during this very challenging winter season. We continue to see an unprecedented strain on our hospitals, which means our paramedics, nurses, doctors, and staff supporting healthcare needs of Albertans are busier than ever. And over the past few weeks, I've been saying that help is on the way. And I'm pleased to be here today to talk about what some of this help looks like and what else we are looking at moving forward on. Let's start with the immediate. as the Premier mentioned, we're taking immediate actions to free up ambulances and highly trained paramedics to respond to urgent calls. We've heard loud and clear that paramedics are getting tied up with transports that don't require their skills or an ambulance. We need more paramedics and ambulances, and we need to free up the ones that we have right now. We're seeing a sustained increase of up to 30% in 911 calls, and the system had limited slack in it before. On top of that, emergency departments are seeing high volumes of very sick patients, so paramedics are waiting longer in emergency. There's no EMS system that could deal with this situation without real strain. The fact is, response times are too long, and we need to get them back down. So we're adding capacity, and we're looking at any new option that can help. One of those options is using other vehicles and staff to transfer medically stable patients who don't need an ambulance. It's not a new concept, but it needs to get scaled up. We have asked Dr. Cowell to do that urgently, and we're here to talk about the plan to make that happen. Now, I'll leave the details of this to Dr. Cowell, but this program will help bring down EMS response times as more ambulances become available for more calls. And it will also help free up hospital beds because patients need transport in order to leave, and some are just waiting for an ambulance. If they don't need one, they shouldn't be waiting for one. Non-ambulance transport will help, and at the same time, we'll keep moving forward on other solutions and adding capacity as fast as we can. We're putting more ambulances and more paramedics on the road, and it's helping. To take just a snapshot in time, AHS had 5 more ambulances on the road in Calgary at the end of November on the day shift, compared to 2 months earlier and 3 more in Edmonton. That's about a 10% increase. And we're supporting AHS in adding staff. The system has 450 more paramedics than 3 years ago. That's about an 18% increase. AHS is looking at any and every option to find more staff, and will rely on Dr. Cowell to help drive that work forward. And we're seeing some improvements in response times compared to the peaks over this past winter. AHS is making progress, in particular on reducing trips into Edmonton and Calgary from the surrounding communities, and as a result, their response times are improving. In Edmonton itself, the latest median response time is right around the 8-minute target, or just a bit above. In Red Deer, it's right on the 8-minute target, and it's below the target in Fort McMurray, Grand Prairie, Lethbridge, and Medicine Hat. Now, we're still struggling here in Calgary, especially because of the challenges that we're facing in emergency, and that's a system problem, not just an EMS problem. We need more capacity to get patients out of emerge faster and free up the staff for the next patient coming in with EMS. And some calls are still taking far too long right across the province. So we need to do more, and that's what today is about. It's just one more step towards our goal. And as I've said before, we're going to work at this until we get those response times back down to within AHS targets. Now, this is a big issue, and it's going to take time to catch up, but we're going to continue to work on it until we get there. And at the same time, we'll continue to add capacity right across our healthcare system. We're doing that in surgery, for example, with new clinics and new operating rooms in hospitals doing more procedures, and with new approaches like central intake and rapid access clinics for orthopedic patients. Adding capacity means adding skilled people. So we're also working on a broader health workforce strategy, building on what we've already done, and we're going to be releasing that new strategy in the new year. And we'll continue to work to build capacity within our system and looking at strengthening our primary care system. In September, we created 3 advisory panels to look at how we should modernize our primary care system. These panels are hard at work, and I'm looking forward to seeing their initial recommendations. And I'll have more to say on that in the new year as well. And before I wrap up, I want to give you a quick update on the children's medication situation. As we announced recently, the Premier and I in Edmonton, we've secured a large supply from overseas. That supply has been going through federal regulatory approvals over the past couple of weeks, and the process is almost complete. So I am hopeful that within the next few days, we'll be able to confirm final approval from Health Canada, and then we'll be able to actually tell Albertans when they'll be able to see these medications on the store shelves. So in conclusion, I'm happy to talk about the latest step forward in EMS, but I want to emphasize it's just one step among many. In EMS and across our entire healthcare system, we're going to keep adding capacity to get patients the care they need when they need it. We made Albertans a promise, a stronger publicly funded healthcare system with better access to care, and we stand by that promise. We're working to deliver on it. So once again, thank you for coming, and thank you for your time. Thank you to all the tremendous work being done by our paramedics, many of whom are in the room, and all our healthcare workers. And with that, I'd like to turn it over to Dr. Cowell.
Thank you, Minister. Thank you, Premier and Minister Copping. Today really is a step forward to increasing the capacity in our emergency medical services, EMS. Today's announcement illustrates the actions that we're taking right now to improve care for Albertans. Excuse me for a second. The non-ambulance transfer program that has appealed very much to me is one of the many actions underway to improve EMS response times, which is one of the priorities, as the Premier said. That program has been initiated but accelerated very much in the past 30 days. One of the roles of the official administrator, of course, is to discover good ideas and accelerate them as fast as possible, and this is one of those good ideas. The new and expanded NAT program will take pressure off our highly skilled paramedics to be available for Albertans when they need medical help. Furthermore, it will give patients who are waiting for transfer more options to get home from the hospital or the emergency department, or to follow up on their appointments more quickly. When an individual is fully assessed and waiting to return back home in an emergency department, they're still occupying space in the emergency department. We need to have a very flexible, available system that can get them home, whether it's back in an urban setting or even far distance into the rural areas. I first became quite aware of the need for a non-ambulance transfer when I was discussing situations down in the Medicine Hat area. And there's no doubt that this new option is going to be wonderful to relieve that kind of pressure in the emergency departments. On the other hand, also, people who are fully assessed and ready to go home occupying an acute care bed, now that we have this new option, they're going to be able to get out of that bed faster and home, not waiting for ambulance level transfer, but can take advantage of this new non-ambulance transfer. It's going to be actually wonderful. So to implement this, we need to be sure that our clinicians know about it and are perfectly able to discuss that with the families and the patients so that an appropriate option to get home can be made. Sometimes it'll still be right that they'll go home with their families, but now with this non-ambulance transfer options, things like community shuttles, wheelchair accessible taxis, and other available options which are capable of securing a stretcher on board and moving a person in a wheelchair can really be in place. And it's not just, doesn't stop just there. People have got to come back to the hospital, back and forth for follow-up, physical therapy, whatever it is. And I just mentioned that I'd had quite an experience last February when I needed such a transport, and I was so thankful that I was able to find one. And it just made all the difference to me and my family to be able to get out of the hospital, back and forth to the ongoing care that I needed to get back up on my feet. So at this point, we are developing materials to ensure patients, families, and staff and physicians are aware of this new resource, and that a list of preferred vendors is now going to be available in all the communities across our province. I would say companies or organizations that are interested in providing this service will be able to reach out to Alberta Health Services to learn how to join the preferred vendor list. As the Premier and the Minister mentioned, this has been road tested, this concept, and it has yielded a rather remarkable 15% change in the use of our higher equipped ambulances. Recently, I had been meeting with the health advisory councils that represent our citizens all around the province, and it must have come up 2 or 3 times in our discussion how much the non-ambulance transfer option is seen as a real requirement back in the home communities. I'd want to thank all of the staff who have worked so hard to get this accelerated into a provincial program over the last few weeks. And, you know, they're also working hard on the other initiatives that we're working on to cover off on the other priorities that the Premier has mentioned. So maybe I'll just take a quick moment to talk a little bit about those other actions in the other areas. We're really focusing hard on finding the solutions that exist and introducing new ones. And we're most importantly establishing key performance measures and targets that will let us know if these actions are actually making a positive difference. We now have the key measures determined on each of those priorities, and we'll be announcing the targets early in the new year so that you will know what we're aiming to do. In EMS, for example, while we have 19 new ambulances, we are also introducing these many different other initiatives to ensure that those ambulances are used very effectively. You know, and again, the non-ambulance transfer is one of those kinds of actions. And it's important to know that we're going to win this battle of shortening response times by a number of important initiatives that all link together to result in a better response time. So the measure we're going to use for EMS is the time from EMS dispatched to arrival at the scene. That's what we're calling the response time. And as I said, we have a measure now that's very accurate to know what that looks like and whether, in fact, it's improving with all of our interventions. For our emergency departments, we're taking many actions also to short wait times. But I should say that the challenge to shorten the wait times has at least 2 components to it. And I'll just speak to them briefly so that you're aware. Patients who seek care often lack access to primary care, either because they do not have a primary care physician or it is after hours and they cannot access their doctor. Patients, of course, can seek help by accessing our 24/7 HealthLink line, but often the health concerns requires a physician's opinion. So they're then referred to an emergency department or urgent care center for assessment. So that's one large group of people who come to the emergency departments, which, you know, are always open and never turn anybody away. The second large group are those who arrive seeking emergency attention for serious illnesses and injuries, and they can arrive on their own or via our ground or air ambulances. So we've been talking about our ground ambulance with the EMS response. But these 2 groups of people are constantly commingling at the front door of our emergency departments. So our actions to reduce wait times have got to include actions to try to work with that flow. So some of the actions we're taking are including expanding our hours for non-urgent pediatric clinics, increasing supports in the ED to support assessment and discharge of elderly and frail patients. The Minister alluded to this. Working with community partners to facilitate safe discharge for individuals experiencing homelessness. We hope to announce something quite interesting on that early in the new year. We're also actively recruiting and working to retain all our valued staff. Everyone knows that that's the challenge in these times. We have reached out to the primary care sector to see whether we can work more closely together to see if there can be an increased availability of primary care for Albertans in the near term and down the road. This will help to take pressure off our emergency departments. So we also have another important measure inside the ED, which we're going to talk about in the new year, and that's the time it takes between when a nurse is triaged the person in the emergency department and the time that a physician can come forward and complete the medical assessment. It is very, very important that we shorten that time to the shortest possible amount, so that when that happens, of course, flow will increase within and will shorten the wait times. So one last thing I might make a point of, we often talk about patient flow, and it's critical in our system. It's critical for very good patient outcomes. And one challenge we've had over the many years has been the number of patients who are actually assessed and ready to move into continuing care, but are stuck and have to remain in an acute care bed because there's no space for them to get back to either at home or into a continuing care facility, such as assisted living or a long-term care facility. You know, I'm glad to say again that we're bringing on in 2023 an additional 1,150 continuing care spaces. That is an amazing achievement, and it took many years to actually get to that level. This is no doubt this is going to improve the flow. And because if you think about it, if you can't get people properly into continuing care, and they're staying in the acute care hospital, if they're staying in the acute care hospital, that puts pressure on the emergency department because now they can't get the people who are ready for admission into the acute care beds, and it just keeps jamming the flow up. So this is a huge, huge achievement if we can get all those beds on, and now the flow will move forward again. One last thing I might make a point of, we're working hard on the surgical wait lists. Had a whole hard look at it in the last 30 days. And I'm happy to tell you that with this Alberta Surgical Initiative in full activity, that I have learned that the number of backlog cases are in fact dropping, and we're virtually back at the pre-COVID level within 1% or so. And we're going to continue to focus very hard on surgical prioritization, central booking, access and intake, rapid access clinics for orthopedic patients, and of course, as you know, we're expanding the number of surgeries performed at the charter surgical facilities. Now, the important measure that we want to look at there is to determine to absolutely reduce the number of people who are waiting outside of the clinically accepted guidelines. It's important that that group get inside the clinically accepted guidelines by us performing the necessary surgeries on them. And I'm here to tell you that we have a very active program, an example of which we know that there's a smaller number of surgeons who have a very long surgical wait list. So we're focusing hard on those surgeons to enable that particular component of the surgical wait list to be shrunk by working with those surgeons directly. So the actions and measures I've gone over, along with those mentioned by the Premier and the Minister, are just the tip of the icebergs of the many actions that we've been have initiated in the last 30 days. We all should know that our healthcare system is a provincial asset, Alberta Health Services being a huge component of it. And I just want to shout out to the amazing frontline healthcare workers who are working their hearts out to make sure that the citizens are properly looked after. They're world-class. Everybody knows that. We're just going to make darn sure that they're working in a world-class situation. And of course, an incredible shout out to our EMS workers who are really and truly frontline, because they're right at where it all begins. So I'll just close up by saying I'm confident the organization is on track to achieve our goals, and I'm very grateful to be able to guide AHS through this challenging time. Thank you. Over to you, RJ.
Thank you, Dr. Cowell. In my role as Parliamentary Secretary for EMS Reform, I am pleased to see we are moving forward with concrete solutions to allocate the right resources at the right time. We know emergency departments across the province are overcrowded, and paramedics often face delays transferring their patients into hospital care. Paramedics have long been advocating for more options than an emergency room to get patients the appropriate care they need. Whether it's mental health care, an urgent care center, or effective treatment at home, non-emergency use of EMS resources poses a significant risk to the health and well-being of Albertans and communities across the province. When emergency resources are diverted elsewhere, the system may be unable to respond to life-threatening emergencies as quickly. This can have an adverse effect on patient outcomes, particularly in time-sensitive emergencies such as overdose, stroke, cardiac arrest, and many others. To sustain our health system as a whole, we need to think outside the box and to leverage all the options before us. As chair of the EMS Advisory Committee, we looked at many solutions for improvements, such as easing ambulance staffing requirements, reducing patient offload delays in emergency departments, and launching innovative response pilots. Part of the committee's review also recommended alternate service delivery options for patients. This included safe, alternate, non-medical transport options that we are announcing today. Transporting medically stable Albertans with no clinical needs will free up ambulances and highly trained paramedics to respond to emergency calls. This is putting our system on track to be more responsive to deliver urgent care faster. We will continue to work to find more ways to strengthen the system so Albertans can continue to receive high-quality EMS care. I believe we are making progress with our healthcare action plan, and we're excited about what's to continue to come in the weeks and months ahead. I want to thank Dr. Cowell and Alberta Health Services for putting this plan into action. We will continue to work together to take more actions in the coming weeks and months to ease the pressures on our health system. And before I close, to our frontline paramedics, dispatchers, frontline workers across the province, since being in my role as parliamentary secretary, I've connected with many, still have many more. Thank you every day for the sacrifice that you make every day. You put on that uniform and you answer those calls, and the hard work you do protecting our communities. Thank you.
All right, thanks everyone. We'll head to the Q&A portion. Like always, one question, one follow-up. We'll take 3 from the floor and then head to the phone lines. Adam, I know you do have an on-topic question, so we'll start with you.
Thank you. I guess my first question for whoever wants to take it. What we've been hearing here from emergency officials here in Calgary is that one of the issues is paramedics are waiting for a while within the hospital, and that's preventing them from getting back out on the street. So how does this specifically address that issue in regards to EMS wait times?
So I'll start and ask Dr. Cowell to comment further. So one of the main issues that this will do is it'll actually improve the pull through the entire system. So as we move people out of hospitals faster, the space opens up, and then that actually ripples across the entire system. But we are also looking at one of the key issues that Dr. Cowell and his staff are looking on, and the Premier and I sort of highlighted, is the need to look at the interface between EMS and emergency departments, and how do we actually speed that up so we can get transports on the road. So this will help, but more work is to come. And Dr. Cowell, if you want to comment further.
Thanks, Premier. That's a really good question, and I can tell you it's one of intense focus. What you're talking about is called the EMS hospital time, and that's the length of time from the moment the ambulance arrives, say at the bay, and the moment it gets back on the road to serve other patients. And absolutely, it is too long. And we are highly focused on how to tighten that time up. One of the principal drivers, however, of that EMS time is what's known as the offload time. And the offload time is the time between when the patient has been triaged by the triage nurse mostly, and when the physician assesses that individual or someone else assesses that can work with the physician. So that time interval is the one that I was referring to, time to physician assessment, that we need to shorten. So it's actually, the way I look at the EMS hospital time, and it kind of looks forward into the emergency department and back into the EMS world. And the sooner we get that shortened, the sooner we're going to have our ambulances back on the road where they need to be, and we're actually going to be shortening the wait time. So there are numerous activities going on that, and one of the measures I was talking about today will actually be right on that EMS time. And we're going to be, I think, able to reveal to the Albertans what our target is to shorten that time down on a consistent basis. And also, RJ, in his report, actually focused on that particular time as well. So it's well known to us that that is a critical time to shorten. Thanks for your question.
One more. I guess, what does this alternative mode of transportation look like, and how is it different than what was previously announced by Premier, your predecessor?
Well, actually, I think if Nick's here, we have actually an expert who can speak to that. And so now we're getting to the people who really know how this works specifically. Nicholas, thank you.
Thanks, Dr. Cowell, and thanks for the question. The application and the utilization of non-clinical transportation is something that has been utilized across the province in different forms. What we're going to be able to do with the announcement today is be able to standardize that. And so in consultation with patients, their care teams are going to be able to make clinical decisions about the movement of patients, utilizing the right resource at the right time to free up ambulances for their work. So this is really about streamlining the work and utilizing resources that we've got in community already.
If you're talking about what does one of these vehicles look like, then I can tell you that because I've been in one. And what they are is an ordinary van, really, that has been outfitted to be able to secure a stretcher if you're not able to weight bear. And so that stretcher isn't rolling around. It's perfectly harnessed, and you need to modify the cabin, I mean, not the cabin, but the the storage area. It drops the floor, actually, so that you can unload this stretcher in a much easier manner. 2 people can do it. And I was told by the guys that looked after me that they can even handle people up to 300 pounds in these vehicles, which is pretty amazing. I'm not quite there. So they could handle me with like a feather. So that was good. And then when I actually moved to wheelchair, again, I was in a slightly different van, which is also modified, again, to very securely anchor the wheelchair. And of course, there's a ramp. I have to tell you that in my own personal experience, the individuals on there, one was a retired paramedic who had started his own business, and another just a very skilled driver, because you have to have that but you don't actually even need the former paramedic. These are designed for, as we say, medically stable or people who simply don't need extra care. They just need a vehicle that can get them from the hospital and home or back to a setting where, you know, they can actually just heal properly and recover. And I was told you can get these things modified really not very far away. Just take an ordinary van and get them modified. Now, having said that, there's probably going to be challenges in the supply chain era. And yeah, so that's what it looked like to me anyway. So I think that's what the vehicles actually will look like.
All right, next question.
Good morning, Premier Jason Markusoff from CBC. With regards to the referendum you were discussing with another outlet on Alberta pension plan, under what conditions exactly would it be held in May, and if not, when exactly?
It's unlikely to be held in May. We have to get the finance minister to complete his work. And there's new information, new data, so he's in the process of doing that now. So he'll have more to say about that in the new year. We want to make sure people understand the implications and the cost. And it's unlikely that we'll be able to roll that out that quickly, but I wanted to make sure people knew that if we did proceed with the decision, then it would be up to the people as the Fair Deal panel had recommended to us.
You say people need to see the numbers and that Alberta over-contributes to the Canada Pension Plan, which may be intuitive for people, but the province has never revealed that Treasury Board study. What does this report say about the long-term viability of such a plan, Alberta going alone without the rest of Canada for a pension, as Alberta's population ages in the long term?
Yeah, when the report's complete and the new data is in there, the finance minister is going to do a full announcement and we'll roll that out. I'm hoping that he'll be able to do that in the early part of the new year, January or February, and all of those answers will be available at that time.
Thank you.
Go ahead.
Hey, Alana Smith, Globe and Mail. I just wanted to follow up on your update about the children's pain medications. I guess this is a question for the Premier and also Health Minister Copping. I'm wondering how long, if these medications are approved by Health Canada, would it take for those shipments to be delivered to Alberta, and how long it would take between that first shipment and then that final shipment, because I understand it would go kind of throughout time?
Well, let me turn that over to the health minister because he's been dealing with it on a regular basis.
Yeah, so once we get, we're looking at other options of how we can expedite it, and working closely with Health Canada. I can't give you the exact dates, but we're also looking at options of can we actually bring the first shipment in pending the final approval, but we also need to get closer because there's multiple steps on that, so when would be the right time to do that? So we're in active conversations about that. As I said before, we are hopeful that we've cleared another number of hurdles. There's a few left, so that we'll be able to get there over the next few days and then be more specific. The first shipment, we're looking at, there's going to be 10 total shipments. First shipment would be 500,000. And then as I said before when we made the announcement, that'll take 3 to 4 days to be able to do the distribution. So I haven't got details yet. And then we'd be looking at every few weeks more shipments coming in, and then sharing shipments with other provinces, and we've and working with the federal government in that regard. And we've already heard from other provinces who are interested to be able to get access to this. But first step, we need to finalize Health Canada, working very hard on it, and hopefully in the next few days we'll be able to finalize that process.
Thank you. I understand you can't provide specifics, but maybe you can provide some sort of estimate between that Health Canada approval and when you might see that first shipment. And then my second question is, I guess, what is the point if this arrives after that peak of respiratory illnesses and as supply issues begin to ease? And, was it worth the cost, and how much did it cost?
Yeah, so again, in terms of the final cost, we're assessing that. We are going to make sure that it is going to be affordable. There is obviously slightly different cost to bring that in. Is it worth it? Absolutely. Right. We still don't have products on the shelves, and even though some work is being done on that, it's still going to take some time. And recognizing that we've gone through the latest peak on flu, and that's on its way down. But typically in a year you'll have a number of peaks. Right. We can't. Whether there will be another one or not, like typically it's 1 or 2, maybe even more than that in a flu season. But I'd rather have it and not need it than need it and not have it, which is where we are right now. So, and the fact of the matter is we have other provinces asking us for this as well, and working with Health Canada. So it is necessary. It's important to get it as quickly as possible. Again, from a timing standpoint, I can't be specific, but the reality is that once we get final approval, days to actually get the shipment here, that's what we're working on, and then 3 to 4 days to actually start to get it distributed. So hopefully that's coming this week, but again, we don't run that process, and we're working with the federal government to actually finalize the last few steps with Health Canada.
Thank you. Operator, can we please go to the first caller?
Bill Kaufman, Post Media.
Yes, hi. I'm just wondering, we've heard that there will be a report, there would be a report available in September, last September, on this fatal dog attack in Calgary last June. I'm wondering why we haven't seen that report yet.
Yeah. So thanks for the question, and yes, we had hoped to be able to have that final report delivered to us by HQCA, in September. My understanding is that an initial report was done, more questions were asked. They went back and did consultation. My understanding, though, that is now that the final report has just been received by AHS, and they're assessing that right now, and then we'll be able to make that available not only in terms of the response, but what all the findings in the report early in the new year. And I guess the other comment is we fully recognize that we need to do a deep dive on this particular issue, but part of the issue is also that we need more resources from an EMS standpoint. We need to actually address our entire flow throughout our entire emergency response system, which includes EMS and emergency departments, and that's the work that we're doing right now and continue to do.
Do you have a follow-up, Bill?
Yeah, just more in line with the announcement today. How many of these converted vans for non-urgent patient transport do we have now, and how many do you think we're going to need?
Okay. With that, I'll ask Dr. Cowell or for staff to actually comment.
You know, I don't actually have the number with me at this moment in time, but I understand that there are, though I know for sure there's an active small fleet in the city of Calgary right now, because I was in one of them. But there also, in the Premier's presentation, you mentioned a number of other communities that already have them in place. In terms of our own fleet, I believe it's less than 10 of those actual vehicles that are owned and operated by Alberta Health Services. So now you can imagine there's a huge push now to find contractors that we would approve on a approved supply list, a vendor list. And the sense I'm getting anyway, Nicholas might have something more to say on it, that there is a fair amount of interest in the community to step up to the plate and provide that service on a contracted basis. So we're open for business on that. So hopefully in the next quarter, the next couple of months, we'll be able to say that we've got a lot of these vehicles available. And of course, the potential, once we do get the fleet up to an appropriate size, is huge, because that's what we've been describing. And that's why we've committed to move it from a pilot and fast track it to a province-wide resource. So that's the best I can do right now with those kind of numbers, but maybe in another 3 or 4 months, we'll be able to be more specific for you.
Thank you. Operator, next caller, please.
Janet French, CBC.
Hi there. First question is for Minister Copping. What exactly, for the children's medication import, what exactly are the regulatory stumbling blocks that are still being assessed by Health Canada?
Yeah, so understanding there still needs to be final, like the labeling is still being assessed, and then final sign off in terms of the factory in Turkey and reviewing of the documents there. That's what I'm led to believe. So we needed, those are a few of the checks that we need to get through, and again, hopeful that we'll be able to get through in the next few days.
Do you have a follow-up, Janet?
Second question also for Minister Copping, I think. Your news release says AHS will cover the cost of transportation for patients who are financially unable to do so. Can you clarify that most patients are going to have to pay for these non-ambulance transports? And if so, why would you ask people using a public healthcare system to shoulder the cost for this?
Yeah, so my understanding is, first of all, these are individuals who need transport, but they're medically stable. This is not a medical transport. However, the normal process is actually to have individuals, pay for non-medical transports. But that said, what's critically important to us is that cost not be a barrier. And so having a program to be able to support individuals who can't afford to pay will do that. But again, this is non-medical transport. But the reality is we want to support individuals, make sure that cost is not a barrier, and that's why we're stepping up to actually to fund it if need be.
All right, operator, can you please go to the next caller?
Morgan Black, Global News.
Hi, everyone. Thanks for taking my question. The first one is for Minister Copping, just in regards to the Stollery Children's Hospital here in Edmonton. So I know you said some of the viruses are peaking, but yesterday we did hear from the medical director at the Stollery that they are redeploying staff to keep up with the current surge and then still bracing for whatever January and February might bring. I'm just wondering what you think Albertan families should expect in the new year at children's hospitals in Edmonton and Calgary.
Yeah, no, well, thanks so much for the question. I had an opportunity the last couple of weeks to visit both the children's, just down the street right here from the foothills, and also the Stollery. And I just want to start off by saying a huge thank you to the tremendous work that's being done by the staff. They have expanded capacity in both locations to be able to deal with what comes through the front doors. The recent moves by the Stollery is to prepare if they actually get more people coming in through the front doors. When we take a look at the numbers, yes, flu and COVID continue to drop. RSV is we're still watching very closely, which is rising, and that's what's driving a lot of the numbers that are coming into the children's right now. We do, we don't know when, but we do expect that peak at some point in time. But I salute both the children's and the Stollery for making plans, because we're not done through our respiratory virus season yet. So even if we get through a peak over the next few weeks, and again, there's no guarantee on that. Even though we have flu and COVID coming down, we still have RSV. That we need to be prepared for, if we get another flu peak in this season. So putting plans in place to be able to support that and make sure that we're ready for it, access to staff, and then quite frankly, and chatting with Dr. Cowell and Mauro Kias on this exact issue this morning, providing the funding that they need to be able to build the capacity to manage through, we're going to do that.
Do you have a follow-up, Morgan?
I do. Thank you. This one's for the Premier, please. Hi, Premier. So the United Nurses of Alberta has written a letter to yourself, the Health Minister, and the Chief Medical Officer of Health asking for an indoor mask mandate to reduce the spread of these respiratory viruses we're seeing, or at the very least, a statement acknowledging the benefit of masking. They're also calling on Dr. Joffe to make a public appearance and then address the situation as well. Just wondering what's your response to those calls for action?
Well, I appreciate all the great work that United Nurses and their members are doing on the front line. They've been working so collaboratively and well with the administration, making sure that we're addressing the surge in patients that's happening during this time of year. We've been very clear. Anyone who feels comfortable wearing a mask should feel free to do so. And the advice from our Chief Medical Officer of Health has gone out through various means, directly to parents, online, through Twitter, to stay home when you're sick. And to make sure you're washing your hands. And if you want to make the choice of a mask and the choice of vaccination, you should do that. So I think that the parents have been very responsible in responding to that message. I think school ends tomorrow as well. So I think that this is, at least we've got a couple of weeks period as we get through the Christmas season, where the kids are not going to be in a congregate setting in a classroom. I always appreciate the input from our frontline workers, but we do support choice.
All right, we'll take one last question from the floor, and then we'll wrap. Go ahead.
Tyson Flora with CTV. I guess, Minister Copping, you were around for this. In May 2022, so this year, you announced the offload delay task force that would look at a lot of the issues you've mentioned here today. So I guess the big question is, other than the number of ambulance that'll be freed up today, the 70 across the province, what's necessarily new or different about today's announcement? And when is a date going to be set for this? Like you say, help is on the way, but when is that help coming? And is it starting today?
Yes, so this latest, what we announced today is starting, well, actually, we have it in place, as we mentioned, on a pilot basis. That's already active, and this is, we're starting right today in terms of, rolling this out across the entire system. Some systems will take longer to actually get it all implemented, but we are doing this today, and once we get it fully operational, this will reduce the need for roughly, based on our pilot, about 70 calls, and then they can use for more urgent calls that we need.
Secondly, just an overall cost to this project. I know there's a lot of moving parts to it, but if you have that, and where are you getting the doctors to maybe conjure up to help with the triages once patients do get to the hospital? We know there's staff shortages, so where are those doctors and health workers coming from to help with that work? And again, the overall cost.
So on the first question, on the budgeting standpoint, we do understand from the pilots this may cost a few more dollars. We haven't got the total number yet because it depends on, we don't want cost to be a barrier. But we are going to, AHS has already said they'll be able to fund that, and quite frankly, if they need more money to make this work, then we're going to support them on that. And I'll start in regarding to staff. We fully appreciate that staffing is a challenge here in Alberta, and quite frankly across the entire country. We are already doing a significant amount of work in terms of looking at increased training, immigration, streamlining the process to actually get more doctors here faster, more nurses, other allied healthcare professionals. So we're continuing to do this work. We've actually had some success, in a number of locations across the province of bringing in new doctors. We actually have the highest rate of practice exams practice assessments in the entire country through CPSA, and we're actually working to improve further on that. So that's part of our work that we've already started. We are going to have, as I mentioned in my notes, an announcement in the new year, sort of putting that all together in a package, and also be able to explain what more we're doing in terms of having healthcare professionals. So that's a part of it, and then actually, ensuring that people can work up to their full scope. Dr. Cowell, I don't know if you want to speak more to the work that you're doing to getting more staff into the emergency departments at this time.
Actually, I think you said it very well. The only other group that I would say we are focusing on is more enhanced use of nurse practitioners, both in our system and possibly in the primary care. So I know the minister has been looking at that, and I want to join him in that, because I believe that is one really important area to supplement, recruiting physicians, for example. And I'm working very closely with our Chief Medical Officer, Dr. Belanger, who is actively recruiting physicians. And he's very well aware of which physicians are more needed than others. And like, for example, we know that anesthetists are very important. You might not think of that, actually, in your first thought, but without anesthetists, you don't do surgeries. So that's an issue. We're looking at more ER doctors, and the good news there is a whole bunch are going to be coming through the residency in the next few months, and I've been reassured that many of them want to stay home here in Alberta, and that would be really good. And so why I just use those two examples is that in response to your question, we've really gotten down into the details of what kind of doctors, how many, and where would we put them. And that's really been rediscovered and accelerated again over the last 30 days, because, my hands are all over that problem, as well as the nursing recruitment, which the minister's got in hand. And we're shoulder to shoulder on that need, because labor is a limiting factor.
All right, thanks everybody.